Andrew Schulz has gone live with his new special on Netflix called Life.
He puts the embryo in my wife. The second he puts it in, I'm like, you say your sperm is like a C+. Blacked out. Shame.
If you have not seen it yet, go ahead, pause this video, go watch it, and then come back here. It is fantastic. And it hits really close to home, not just as a doctor who cares for fertility patients every single day in my practice, but also as a fellow patient. I remember whenever me and my wife were trying to get pregnant, we had to go through IVF ourselves. So hearing Andrew tell that story in a way on stage and then now in the form of an interview, it just really just tugs at your heartstrings and really resonated with me deeply. So I wanted to share that with you guys and also give you some tidbits about what things look like on the male side of fertility and how we go about that workup and what patients may experience as they go through this process. So let's go ahead and get started with this interview.
I walked in that hospital with so much confidence. They handed me a cup. I'm handing them back a martini. I'm ready. Remember, I went in the room. I jerked off. I opened my eyes. I looked down. I thought I missed.
There is nothing that we can do as doctors to make producing a specimen in clinic not awkward. This is one of those things that is so important to the male fertility workup. You cannot evaluate your fertility as a guy without getting 3 basic tests. The first is the semen analysis. And believe it or not, we actually have to get 2, sometimes even 3 of these to make sure that the numbers are accurate and we didn't just have a bad day or something. We also have to get blood work to check hormones, and you also need to do a physical exam on the guy to make sure there aren't any lumps or bumps or anything weird going on. But I tell my patients all the time, man, there's nothing more awkward than coming in the doctor's office and do it. I had to do it as a patient whenever I was getting worked up, and my heart goes out to you, man, but we got to pull the trigger and just get this taken care of.
There was so little sperm in this cup, I could have counted them individually. There was a red line on the cup 3/4 of the way up. For what fucking reason, I do not know to this day. 3/4 of the way? What zoo animal hippopotamus cups are you giving out to people?
So, fun fact, the minimum ejaculatory volume for a semen analysis, under which it's considered low, really isn't that much. It's just 1.5 milliliters. I mean, we're talking about really just, several drops. And that's actually the bare minimum. Now, if you look at average, it's gonna be closer to maybe 2 to 3 milliliters for most men. But there are some men that I've seen in my practice with 7, 8, and I'll be honest, I even had one patient that sticks out in my mind who had a 13 milliliter ejaculate. Damn! Which I told him he set records. And I'll tell you, you gotta have a sense of humor in this job, but you also have to try and figure out which of your patients has a sense of humor and who doesn't. I'm better at it now, but I remember walking into that patient's room and it was him and his wife, and they were just super anxious, just sitting there. They were so, nervous about what I was going to tell them. They were afraid they had bad results. Believe it or not, he was record setting, not just the volume, but the concentration, motility, everything was fantastic. So he totally checked out clear. And, his, young wife was sitting there and she was like, but doctor, his volume was high. Is that a problem? And I was like, well, I mean, we might call it a choking hazard, but beyond that, no, it's not a problem. And dead silence, no reaction whatsoever, just absolute stone face. So I just very slowly backed out of the room and I never saw them again. And you live and you learn. So there you go, learning how to counsel patients in the world of male fertility.
Why are you even giving me a cup? Give me a contact lens case. I'll turn that shit into a Guinness.
This is a personal story. This whole thing is about your journey with Emma in trying to conceive a baby.
Yeah.
And no detail is spared.
Yeah.
But so it was very personal. It was unusually personal for you.
Yeah.
Did you run it by her first?
So the thing was at first, this is the most male thing, but I assumed that the reason why we couldn't is because it was her fault, right? And I talk about it in the special where I'm like, she was really concerned it was her fault, and I was really concerned it was her fault. We were all really concerned.
Obviously.
So this is a common misconception. If you look at the data, 50% of couples that are struggling to get pregnant will have some male factor contributing to it. And that's really important. That means that if we don't check guys, half the time we're missing the point. So if you're struggling to get pregnant, it's important to get evaluated as a guy and not just leave it all on your female partner. Getting checked as a guy is straightforward and relatively easy, just 3 basic tests as we mentioned earlier. There's nothing necessarily invasive. Don't worry, no one's gonna give you a prostate exam or anything like that. But by checking sperm counts and basic hormones, we can learn a lot about somebody and what might be needed in order to help get a couple pregnant.
Her fault.
Yeah, because like men, we have this like confidence in our sperm that like there's no real reason why, but we just know, right? Like every time I've ever had sex with a girl, I was like, oh my God, this is gonna be crazy. Like what should we do? How do we, calling the next month? I know she's pregnant, guaranteed, which I now know is a waste. And once we found out that her ovaries were perfect and my sperm was horrible, it actually made it a lot easier for me to talk about.
So Andrew is getting at something really important here, which is the emotional impact that infertility has on patients. So if you look at patients that are struggling with infertility, they will often deal with the same sort of anxiety and depression that people with a new cancer diagnosis will feel. This is something that eats away at not just men, not just women, but it can eat away at a relationship. So that's why it's really important to use this as an opportunity to grow closer together as a couple. I talk to couples that come see us all the time, like, listen, you're gonna face struggles in your relationship, and this is probably gonna be one of the hardest ones you face to date. But if you face it together, you can come out stronger on the other side.
To talk about.
Really?
Yeah, because I think the reason why like anybody who has fertility issues, one, it's very isolating because you're so protective of the person that you love that you don't, a lot of women feel a lot of shame around this.
Yep, true.
And at first I felt like real shame. I was like, does God not want me to have a child? Like I was like, I didn't understand it. Like, I think I'm like a pretty good person and I'm kind to people. And I'm like, why is this happening? Like, what the fuck is going on? And yeah, so I get that. And a lot of women, if they are struggling, they're just like, they feel like it's, I don't feel very stigmatized, right? And
so what Andrew is getting at here is this sort of deep internalized shame that a lot of patients feel when they're struggling with fertility. It's something that I see a lot with guys because we tend to view our fertility as equivalent to our masculinity, and that if we don't have, great sperm, that we're, somewhat less of a man. I will tell you that is absolutely not true. Your value as a guy is not tied to your sperm count. In fact, some of the toughest, strongest guys that I know have low sperm counts, and I met them through the course of my practice. What he's expressing here is something that I see patients struggle with constantly. And so it's really encouraging to see him give this a platform, so hopefully more awareness can be brought to this and we can drop the stigma surrounding male fertility.
And but once she was perfect and I was fucked up, I could get on stage, and it was really cathartic to talk about it. And then once I started talking about it, I literally thought that I was like, this was like a 1 in like 10 million thing.
Oh, wow.
The second I started talking about it, all my friends start telling me that they're doing IVF.
Oh, wow.
I literally thought that I was like, this was like a 1 in like 10 million thing.
Oh, wow.
The second I started talking about it, all my friends start telling me that they're doing IVF.
Oh.
So male infertility struggles are much more common than you might think. Statistically, about 1 in 6 couples are going to have a hard time conceiving, so estimated around 17%. If you do the math, half of those couples are going to have some sort of male factor contributing to it. So that means if you're looking at a crowd of 100 guys, about maybe 8, maybe even 9 of them might experience some form of infertility. So what Andrew is dealing with is something that is much more common than what people might think. But as guys, we just don't talk about it, which is why I think it's important to make this more common, to make this less stigmatized so that guys can open up and seek treatment.
IVF.
Oh, wow.
And like all these people in the audience would hit me up afterwards. They'd be like, oh yeah, same thing happened. And I was like, what the fuck? Is this like the last taboo subject?
How did anybody ever get pregnant before IVF? Because everybody's doing it.
Dude, it is like, it's unbelievable. It's almost like, I was like, does anybody really get abortion? Like, I'm like, it's so hard to get pregnant. Why is this an issue? Like, how often do these athletes have unprotected sex that they have 20 kids? Like,
so this is a funny but true story. Me and my wife tried for about 3 years to get pregnant before we finally moved forward with IVF and had our son, which was fantastic. But even though I'm a physician and infertility is something I deal with every single day, you kind of turn the doctor part of your brain off whenever you go home at the end of the day, like most of us do with our jobs. And so it's important to remember, just because you had a hard time getting pregnant with the first kid doesn't mean that you're gonna have a hard time getting pregnant with the second, or vice versa. I have a lot of couples who come in struggling to get pregnant with their second or third kid, even if the first one was no trouble at all. So in our case, it ended up in our daughter, who I love to bits, but totally showed up unannounced, no planning whatsoever, just all on her own. And I will tell you, my heart goes out to my friends and my patients who are struggling with infertility. But if you don't struggle with infertility, it's a lot easier that way. It's a lot more fun and cheaper.
Like, I couldn't believe it. It was unfathomable. So, but then it became like, yeah, there, as brutal as it was, there was these kind of funny moments, that being one of them, just the humility.
Going into the room with the lady. Oh, we just talked to the audience. You know, Doug came in to say hi to Andrew in the commercial break, and we were bonding over our shared experience because he and I did IVF with our kids too. And Doug joked that after he had to donate the sample, first he said he was going to wear like a red crushed velvet smoking jacket on his way in, and on the way out he was just going to be like, "That was fantastic. I was amazing."
Yeah, I was always thinking about, like, do I make noises in there? Like, how uncomfortable do I make it for the other guys at the clinic? Like,
as somebody who runs a male fertility clinic, I will tell you that investing in good soundproofing is absolutely priceless. And I am very proud of the setup we have at our new clinic.
like just screaming random things.
Yes,
Sesame Street. Just something crazy. But yeah, it's like, oh, it was crazy.
It was like a walk of shame when you're walking by all the other guys there. Everybody's there. Oh God, I know what you're about to do.
It's so humbling.
Yes.
Like, you're just sitting in this room.
What he's describing is totally a thing. The walk of shame to the semen analysis room. I have been there and done that more than once during our own fertility journey. And it's so awkward because you feel like everybody's looking at you and they know what you're about to do. But the actual reality is, as someone who works in a fertility clinic, we have so many people moving in and out. I have no idea who's going to the semen analysis room and who isn't. We have people in the waiting room for 5, 6, 7 other things. So nobody's really looking and nobody really cares. So if you have to give a semen analysis, at least at our clinic, I'll reassure you that don't worry, nobody's looking at you.
Room, like all of you are in there. You're like,
So why did they make you go in to give the sperm sample? Couldn't they?
So I did it from home once.
Okay.
This is an important point. Why do we have men come into the office for a semen analysis specimen as opposed to doing it at home? Although home is a lot more comfortable, the truth is that it takes time to transit that specimen from home to the office. And unless you live right next door, sperm can actually die during transit, which throws off our measurements. So if at all possible, it's always better to give a semen analysis specimen here in the office.
The whole, I haven't even put like a lot of the stuff in it, but like the whole journey was brutal. So the first one I did from home, which was like, I'm in the room. My wife like hands me the thing, like it's like homework. And she's like, okay, I'll give you 30 minutes. You go do your thing. I'm going to go outside, or I'm going to do the dishes. So like I hear her doing the dishes in the background where I'm like being mandated to masturbate. And I'm like on our bed. Like, I don't think I've ever masturbated on a bed. Like, I'm just on our bed, and the bed is made perfectly. Like, everything is, like, set up. And I remember at one point, like, I'm just like, I don't know, this is, like, so weird. And I, like, looked up, and the TV was off. So it was just a black screen. So it's a perfect mirror of me.
Oh, no.
And I was just like, this is the saddest day of my life. I'm sitting Indian style on my bed trying to make a sample to go in this cup. We send that sample.
Masturbating on command is, again, one of the most humbling things you will ever do as a man. So shout out to all my fellow fertility patients out there.
That sample in, it comes back and it's like, it's not good. Oh. And they're like, not only are they not swimming, they're like shaped weird. And I was like a little defensive. So I was like, well, could that be from like the speed that they hit the cup? Like maybe.
So what Andrew is talking about here are the different parameters we look at with a semen analysis. And so a semen analysis has a lot of different variables that can all be important in their own way. But the most important variables are volume, how much is there, concentration, how many sperm are there per milliliter, motility, how well are they moving, progressive motility, how many are actually moving in a forward manner in a way that could actually fertilize an egg. And then the last one is something called morphology. Each one of those are important in their own way, and often we'll use that to calculate a number called the total motile count, which is volume times concentration times motility.
Maybe, the blunt force trauma kind of warped them a little.
Flow is just too strong.
It was too strong. That's what it is.
A lot of people, Schulz included, get really worked up about morphology. And I think it's because people think that funny looking sperm equal funny looking babies. And that's just not how it works. In reality, the most important factor for determining a man's fertility potential is not morphology. It's that calculated number that I mentioned earlier, which is your volume times your concentration times your motility for your total motile count. That is what gives us the best rough estimate of your ability to help conceive a pregnancy.
And they're like, no, that's definitely not it. And I was like, okay. And they go, well, why don't you do this for like a couple months? Wear baggy underwear, ice your balls every single day.
Oh, ice them.
Yeah.
Whoa.
Icing your balls does absolutely nothing, okay? When it comes to trying to improve your fertility as a guy, like what can you actually do? First off, give up any sort of tobacco or nicotine, all right? Second, drop the alcohol. Alcohol has been linked to lower testosterone levels and lower sperm counts. 3, hit the gym. Working out, including resistance training, has been shown to improve testosterone levels and may help improve fertility as well. And the last thing, try to cut out processed foods out of your diet. I tell patients at the end of the day, if it comes in a can, a box, or a drive-through, you probably shouldn't be eating it. Now, on top of that, some smart supplementation may be helpful, although it's debatable. A daily men's multivitamin is safe and may contain certain micronutrients that would help improve fertility. And generally accepted, CoQ10 is another excellent supplement that's been shown time and time again to help improve sperm motility, and I recommend it to my patients all the time.
Yeah.
Something I have to talk about real quick though, all right? If you're looking to try and buy a vitamin, buying a fertility vitamin is kind of like buying wedding cake. It's just freaking cake, but you're gonna pay 5 times the price just because of the letters in front of it. Generally speaking, Costco vitamins, Costco CoQ10 are gonna do you just as good as any of the specialty fertility vitamins that you can find online.
Yeah, I guess that's a big thing.
Ronick, unless we ever come out with one. If we ever come out with one, it's gonna be awesome and we're gonna sell it on the channel.
Yeah.
Whoa.
Yeah. I guess that's a big thing. Don't drink anymore, don't smoke anymore, and take these pills. And then we'll try it again in like a month or 2. And I did that.
Something important to mention here is that Schulz talks about starting some medication and then rechecking a semen analysis in a month. It actually takes somewhere between 71 to 76 days to make new sperm. It does not happen overnight. It doesn't even happen in 1 month, which can be one of the more challenging parts about treating male fertility is just the waiting that's involved. So it's important. If you're questioning your fertility as a guy, get checked out and do it sooner rather than later. Reason is that the more time we have, the more flexibility we have to improve you to hopefully avoid things like IVF or IUI that may be more costly.
Did that and we tried it again and it got worse.
No. What?
And I was like, why do you think that is? And the doctor's like, we've never seen this before.
There's some pride in that. Yeah. It's gotta be.
I will tell you, I have seen patient semen analysis numbers get worse over time very frequently. Unfortunately, some people, whether it's genetics or something they're being exposed to, will experience a progressive decline in sperm quality over time. All the more reason, if you're experiencing difficulty conceiving, get checked out sooner than later.
Yeah, it's got to be a little bit.
I'm setting records.
I told a story one time when Dave Rubin was on, but Doug had the funniest experience there where they make you ejaculate.
Yeah.
Like 24 hours before the real sample that's going to be like your future kid.
Yeah.
They want you to clean the house.
Yes.
It's like, I can't remember if it's 24 or 48 hours.
I think it's 48 hours before. Yeah.
Okay. So, but they want it to be 48.
Yes.
And they don't really want it to be 46
Nope.
or 44.
Because you need the amount of time to build up the new batch.
Yes. So like timing does matter.
So what Schulz is referring to here is the time that you need as a guy to recover before submitting a specimen. This can be debated and it depends on your clinic and what their individual lab policies are. But generally speaking, we want a bare minimum of 48 hours before a man submits a semen analysis specimen. And that's 48 hours of complete abstinence. So no masturbation, no intercourse. Reason being is that it takes time to build back up the ejaculate so that we have an accurate assessment of where a guy stands. Now, I will tell you, In my experience, if I ever tell patients 48 hours, they hear 2 days, and then it ends up being just a day or a day and a half. So I commonly recommend having 3 days of abstinence, because in that case, we have a better chance of someone actually waiting a sufficient amount of time. But believe it or not, if you wait too long, the numbers can look even worse. So the ideal amount of abstinence before submitting a semen analysis specimen is somewhere between 48 hours and 7 days.
Timing does matter. It just so happened that on one of ours, we were visiting my nana, who was literally like 90 at the time. And we were playing dominoes, and I was like, oh, Doug, it's time. And he was like, what? I'm like, you got to go in there right now. My poor husband. And you know, it's like one of these older person's homes where like there's 5 inches between the bottom of the door and the ground. You can hear every piece of conversation. And the dominoes, like, you're palming the double 5, you know, and Doug's sitting there behind the door. Horrible, poor Doug.
This is the thing about this.
Do what you gotta do.
So something that they're not mentioning here, which bears discussion, is that whenever you submit a semen analysis specimen, depending on the lab that you go to, sometimes they don't want you to use any lubrication, which means that you just have to do it with your bare hands, which is quite an uncomfortable experience for patients. Sometimes we can mitigate this, use something like mineral oil, but the problem is that if any of that gets into the cup, it can throw off the semen analysis results. So again, respect to the guys that have to go out and submit a semen analysis that are doing the right thing and getting checked out.
Horrible, poor Doug.
This is the thing about this.
Do what you gotta do.
The journey is brutal when you're in it. It is the hardest thing that you'll go through in your life. It's definitely the hardest thing we went through. And, but after the fact, it is hysterical.
Yes.
Like,
can't believe what you've been through.
Yeah, and like there are so many of these things that are so funny.
This is absolutely true. Me and my wife still laugh about our entire fertility journey. I remember having to make the long walk to the room to give a specimen when my wife was going in for her egg retrieval. I remember trying to fight back tears as I'm walking down to give this. It is a total whirlwind of emotion. And I would say, speaking on a very deeply personal level, I'm actually grateful for the experience, because it makes it so much more human when I'm counseling patients who are going through that fertility journey, that are going through those struggles. Like, this is not something that is kind of distant and clinical and sterile. This is really the most human and humbling thing that they will go through. And having gone through it myself, I mean, I laugh, but my heart goes out to Andrew and every other couple that's had to deal with this.
Things that are so funny. And the beautiful thing about having a child is you get this like amnesia for what you went through to get there. And I think that's actually kind of like built into our DNA, so that we keep making them.
I totally agree. Same women have been saying that for eons because of the pain of labor. And it's so, devastating. And then you forget all about it. I never had labor because I had 3 C-sections, but my friends tell me it's extremely painful.
Oh, Emma was in there for 24 hours, and then she had the C-section because the baby's heart rate dropped.
Oh God, that's scary.
Yeah, the whole thing is terrible. When you were doing the shots before to prepare for the IVF, like, did you have any fun mood swings or anything?
Oh yeah, I was actually fine.
So this is something that's extremely common. Whenever a female patient is going through an IVF cycle, she has to receive multiple hormone injections to stimulate her ovaries so she makes as many eggs as possible, so that those can be retrieved with an ultrasound probe and a small needle and be used for IVF. And unfortunately, this includes large doses of hormones like estrogen, which can really affect mood. And as far as mood swings go, I have absolutely been on the other end of those mood swings, and it is a very real phenomenon.
I did not have weird mood swings, but it was very funny because Doug does not
Megyn is totally lying here. Everyone has mood swings. She's just misremembering.
As it turned out, he didn't have to, but we thought he did.
Yeah.
But you pull out a needle, and Doug is one of those like,
so he couldn't do the shots for you.
But he had to in the beginning.
So when me and my wife were going through IVF, she could not give herself a shot to save her life. Still can't give herself a shot. So that meant that every single night at the exact same time, I had to come home to give her an injection. And this was when I was going through my fellowship subspecialty training, which involved a lot of late nights in the clinic. Sometimes we didn't have to go to dinners to talk about research projects. And I had to excuse myself and run home so many times so I could inject my wife at just the right moment. And I don't know if she's ever thanked me for that. Calling you out, honey. Love you.
As it turned out, he didn't have to, but we thought he did.
Yeah.
Because in the beginning, they really make it up into a thing. Like, you got to mix the compound, and then it's like kind of back in a hard spot to reach. You got to ice the area. We're like, oh my God, like our future family depends on this. And Doug was in a hot, like a cold sweat. And the superintendent of our building at the time, his name was Lance. And they were like, it's very important that your wife have a partner that helps with it. And Doug is like, this is going to be very hard for Lance.
Yeah.
But he did it. He did it. He got it through. But honestly, by the third child.
So another fun story that I want to share is as we were going through IVF, one of the most important injections is something called the trigger shot. The trigger shot is administered immediately prior to the female partner going into the hospital to undergo her retrieval. And it's so important that you administer it at just the right time. And what had happened is that there had been an error in the pharmacy, and we were unable to get that medication that we so desperately needed in order for our IVF cycle to be a success. And in a total panic, I actually called a guy named Sean Nurian. Sean owns Empower Pharmacy, the largest compounding pharmacy in the entire United States. And I called him just desperate, saying, Sean, do you have any HCG lying around? My wife needs a shot. Otherwise, our whole IVF cycle is going to be totally trash. And I kid you not, Sean drove over with a vial of HCG, and I'm there on the kitchen counter doing math, trying to figure out her exact dose. I draw it up. She's asking me, how do you know that's the right dose? Is that the right dose? I'm like, it's the right dose, of course. And she's like, how do you know? I'm like, I'm a doctor. This is my job. And I managed to give her the injection, and our retrieval went great. And so for the rest of my life, I will be grateful to Mr. Sean Nurian for what he did for our family that night.
Third child, Doug was no part of it. I was like, I need no ice. I'm good. Boom, we're done. Off to the races.
It is crazy that they make you mix it at home. So anybody who's not familiar, they give you these two, hormonal compounds, and you have to put them together in the syringe.
In just the right proportions.
I'm like, why isn't this done at the lab? And then we just hit it.
So what they're describing is called reconstituting the medication. So whenever you get this sort of specialty hormonal fertility med, it actually comes in a powder form. And this is because it will degrade extremely quickly whenever it's put into a liquid. So for just real compounding and manufacturing purposes, they create it separate as a powder. But that means as a patient, you have to draw up with a separate needle and syringe the amount of bacteriostatic water needed to dilute that down. And it kind of feels like a science project. Once you do it once, it's normally fine. We have patients do it all the time in our clinic, and we'll have them come to a special teaching visit where our nurses will teach them how to do it. And then they put the medicine in a little freezer or a cooler with some ice, so that way they can take it home and toss it in the fridge. But it can be pretty disorienting when you're doing it for the first time.
You don't have to make the Kit Kat, right? Like make the bar and then send it to me. Right. And I remember watching my wife do these things, making sure it's the right amount. You got to push a little out so no air gets in there.
Right. So you don't give yourself an air bubble, life or death.
Literally. And
So what they're discussing here is a phenomenon called an air embolism, and it does not exactly apply to what they're talking about. So the majority of fertility injections are actually given subcutaneously rather than submuscularly, or what's actually a problem, which is intravenously. So an air embolism is whenever you get a pocket of air that's injected intravenously, and then it could go to your heart, lung, brain, and something bad could potentially happen. Now, that's actually exquisitely rare, but what they're talking about is a subcutaneous injection where you're just injecting this, underneath the skin into the fat. If you accidentally inject some air in a sub-Q injection, don't worry, you'll be fine. It won't turn into anything. Worst case scenario, you might get a little knot there that takes a day or two to resolve. So rest assured, air embolisms, not a risk with sub-Q injections.
And she's scary. Like, did I push too much out? Will I not get it? Is this... But there was fun. I mean, Emma would get it would really get her going.
Would she get angry or just overly emotional?
Oh, angry.
I want to see a video comparing the anxiety of a couple going through IVF, trying to make sure they've got just the right amount and administer it so carefully, with all of my patients that are popping gear in the back of the freaking gym where they're just drawing up 2 cc's of tren, and they're like, yeah, it looks like it's about enough. It's fine. So I'd say that to offer some peace of mind to my fertility patients that don't worry, We will teach you how to do it. You will figure it out. And you know, if the gym bros can figure it out, so can you. All right, guys, so that was my reaction to Andrew Schulz's interview with Megyn Kelly, talking about his fertility journey and his new special, Life, on Netflix. I just watched it last night. If you haven't seen it, go check it out. It is absolutely hilarious. As far as we go here, go ahead, drop a comment down below, hit that like button, subscribe, hit the notification bell. Every little bit helps the channel out. If you want to learn more about men's health, this is the place for you. I'm Dr. Alex Tatem. Thanks for watching.